Hi, I'm Dr. Segura with Studio R Aesthetics, and I'm here with two of our clients today, Kim and Jim. We're going to be talking about bioidentical hormone replacement therapy. Kim and Jim, can you guys tell us just a little bit about yourselves?
Absolutely. I'm Jim, and we were introduced to bioidentical hormone replacement therapy years ago. And looking at the different types of available, we tried lotions, we tried the clear liquid, topical, and then as we explored further and learned more about it, we were introduced to the pellet injection. And we just noticed we were slowing down as we got older. I ran a landscaping business for 25 years, and in that capacity, I worked directly with the guys. And I just noticed I wasn't as capable as I used to be. Everything I did took a little longer and ached a little more. And as a consequence, I didn't want to feel that way. So we tried regular supplements, and what we found over the years is nothing has worked as effectively as what this product has done. What I noticed prior to taking the pellets and getting involved in this type of therapy, I slowed down. I physically slowed down. I couldn't do the work. I used to work 10 or 12 hours a day in the landscaping field, and I was exhausted. I'd get in the truck and I'd sit down in the truck, and it's like, man, if I could just take a nap, I'd feel better, and I could just finish the day. And I noticed when I got out of the truck, it was like this whole being hurt. It was just like, ugh. And I used to come home from work, and I can remember telling Kim, I just can't do this anymore. And it was, when you're a man and you're physically active and you're working like we do, it's really hard to admit that you're losing the thing that makes us whole. And what I noticed from having gotten the treatments, and we've been doing this for 25 years, I can feel it. It's as predictable as the blood tests that we take to verify the results that we're getting. And my feet hurt when I walk. We do 4 to 6, maybe 7 miles a day. My feet will start to ache to a point where it's like, man, I just want to go home. I notice it in my elbows, my joints. I'm not a runner, but like if we're out in the woods and there's a hill, I can jog up the hill. Not that I'm ever going to be a runner. I just never have done that. But I feel more physically alive. The afternoon, 3 o'clock, when you want to have a cup of coffee, all I want to do is take a nap. And
this was prior to the
yeah, usually about 2 or 3 o'clock in the afternoon. Now, if I'm on the middle of that cycle, 4 to 6 month cycle, I'm golden. You just chug through the day, and you feel more alive. And it's not just physically, it's mentally, you're more alert, and sexually you're more active. Everything about the pellet and the procedure is a plus size. I don't see a negative aspect in it anywhere.
So for people who are similar to you and maybe considering hormone replacement therapy, what advice would you give them?
I would say that you're probably doing exactly what you need to be doing. You're doing your research and finding someone that you can have confidence in and learn from as you begin this journey. It is part of taking care of your health. So step one is, who'd you get your recommendation from? Who did they recommend? And it is nice having local providers that we can work with. We did drive a lot as we began our journey. This is becoming a lot more mainstream than it has. Most people never heard of this when we mention it. So get a good solid referral from somebody you trust, and do a little bit of research, and then build a relationship with them, because it is part of being healthy. And
so you guys mentioned driving 5 hours and going to providers. You've seen multiple providers over the years. So if people are interested in hormone replacement therapy, what do you recommend that they look for in a provider that they're going to choose?
The one doctor that we went to out in Ohio, she's a runner. I think she was late 60s, early 70s. She's healthy. I mean, you could just tell this lady was alive, and she'd been doing it for a while. And that is one of the things that I like, knowing that my practitioner is
also doing it,
taking care of themselves properly.
Yeah.
In other words, their firsthand experience, they understand. It's tough to tell people what you feel. In other words, it's very subjective. Put a number on it, like what's your pain threshold? What pain are you feeling? So how do you tell them how much better you feel when you get that sort of a supplement, and it takes you from, whatever you are. I think I might have been as low as 200 or 300 when I first started this. And I'd cry during commercials. I mean, I'd be watching a stupid commercial.
That is a change that we did see. We couldn't watch a Disney movie without him crying.
We've got a neighbor, she's 83, and she's just great. I'm not kidding. She climbs around in trees.
She has
She's got a little
pellet
saw,
therapy.
and she does all of
Yeah.
the work in her yard. 83, and as we are aging and living longer, this is a real important part of taking care of yourself. To see the vitality in this lady walking up and down the street, and she's out in the yard doing yard work that a lot of 50-year-olds aren't doing or not capable of.
Yep.